A treat today for MUGSHOTS and Coffee. I'm in Chandler, Arizona with a very special physician, a very extraordinary physician, Dr. Kevin Chan. I'm with Dr. Kevin Chan, and you're going to really appreciate this guy. He's quite the character, and he's really got some interesting twists on longevity that you and I need to absorb. There's a whole wall up here. You're pretty passionate about medicine. Where did all that come from?
I understand what happens, what is, to me, the most valuable asset in life. Right? People ask, what is the most valuable thing to you? And what do they say? Money? Or, right? And they might even say health. And I said, no, it's not health. The most important asset is not health. What I would say is, no, the most important asset for me is time. Time is something that even money may not buy. Right? I mean, I can do whatever I could do, but hey, a year past is a year past. Right? I'm 48 years old right now. Next year,
you're a young guy.
Yeah, I know. But by number, right? But next year it's gonna be 49. Right? Can I say next year it'll be 47, and then next year 46? So time gone is gone, right? Time past is past. So I totally understand the value of time. Right? So that's the reason why I got into medicine, because I believe that being a doctor, at least, right, if I do it correctly, I would be able to some extent, buy time. Now, as an attorney, for example, right, an attorney may buy you time or save you time from jail.
Right, yeah.
Right? Okay, the attorney may be able to shorten your jail time, but a real doctor, hopefully, can improve your real time, can expand your health time so that you can get to do what you want to do.
One of the things we've talked about is being a great dad, having a great partner, and keeping personal relationships in order with families and that. And I notice you've got some great dad awards and lots of family pictures. So
that I can become a great dad is because I have a great wife. A great mother. In fact, she's right outside, right? So she takes a lot of work from me so that I can concentrate what I want to do. In fact, sometimes I feel like it's so unfair for her that she have to endure like all the work that we have to do, and I travel quite a bit, and I travel, in fact I just came back from a conference once again, so yes, I can become a great dad, but that is because it is in the context of having a very, 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 very a good and responsible wife. So I have to give her, thank you for saying that, but even my children tell me, super dad, but super dad only exists because I have a super wife.
Dare I ask, you may have even seen Angelina and I, we fence, we get into it, we're
fencing.
Always, right?
Oh, okay. Oh,
yeah, we literally fence.
Oh, okay.
Okay, but she chose to be left-handed. She's not left-handed.
Yeah.
She chose to learn fencing left-handed.
Yes.
You know why?
You gain edge.
Because there's an advantage.
Yes.
Right?
Yes.
That's how she, what would be one secret to having that you have embraced, or you are able to have, you're working together well, it's working, what are you doing? Because there's a lot of people that are like, I could never spend that much time around my spouse.
Because I have two rules at work and in my house, and this should be funny, right? Rule number one is she's always right. And rule number two,
that's funny, I got that rule too.
Rule number two, in case she's wrong, refer to rule number one. so right, with that being said, yes, we work very well, right? For the past 20-something years together, you know. So no, I think another reason is because we're in different departments, right? I'm a doctor, and she kind of run the office. So we're not butt heads in terms of, well, I want you to treat the patient that way. No, I want you to run the office that way. No, right? She respect my clinical judgments, and I respect the way she wants to run my staff. So I think that is another thing, that we are not in the same space, right, literally. Even though we are in the same physical space, correct, but we are not in the same intellectual space.
Right.
I'm the doctor. I focus on clinical stuff, and she focus on administrative. Even though I'm the big boss here, and I focus on management. Yeah, but remember, the difference is, and I told my staff, I focus on the forest. She focus on the trees.
Right.
Right. I focus on the big picture, and she focus on the individual, right, members and the details, which I don't choose to want to know. So that's another secret. How we can work well together. In addition to the rule that I told you.
Right. Yeah. The other night, you were talking about taking personal responsibility.
Yes. Absolutely.
You got all fired up. You're all super emotional about that. What's the deal about people who do and don't take responsibility for their welfare?
Because if you do not take, what I call APR, absolute personal responsibility, you always live in this victimhood. That you have to do this for me, right? The way I am today is because of you. It's your fault. It's your fault. It's theirs. It's his. Right, knowing that the only thing that you can change in life is really you.
Yeah.
The only thing that I can work on myself to change is me. I cannot have control on you or anyone else, right? So as much as I want to change them or blame them, I might as well change me. So if I really want to have a different outcome, I have to take personal responsibility to change myself. And especially in healthcare. Today, that I realize that the way the healthcare system, is really encouraging, right? Or even with drug companies out there, right? We are really giving people the idea that, you know what, we will fix you, right? You have to go to a doctor so that we take care of you. So you go there so we can do you, right? You lay there and I will work on you, right? And you're sick. It's not your fault. That is because you need a drug. So let me give you a drug to treat that condition. So I'm not saying that's wrong totally, right? In some extent, we do use medication, but when we only rely on medications, right, to treat everything, then I feel like I'm taking away your responsibility. That what can you do, right, to improve your health? I think that is what is needed to change healthcare.
Yeah. How about if you give one good tip to guys that are taking responsibility for their health? They're managing their weight, they're exercising, their sleep, their water, their nutrition, they're doing everything they know, but we still aren't sure. There's all this emerging technology.
Yes.
I can get my panels done, I can get my DNA done, I can get all this, spend all this money. Give us a tip about who can help us interpret that data, who can map a roadway for our wellness.
Good. So I'm glad for those people who are taking responsibility. Right, first, because they have to understand that you cannot depend on your health insurance, or what I call sick insurance, for healthcare. Understood? Great. Then the next step is to find the right type of physicians or healthcare providers who are trained in healthcare, not just disease management, right? Anyone with a license who gives you a drug. Right, we've got to be able to find those, and I'm sure there are resources in terms of professional organizations that you can start looking at and identify those doctors who are trained in those areas, and start with that. Right, first identify those doctors who are trained beyond the box medicine, right? Not those what I call COMD. COMD stand for common, ordinary medical doctors. That you can just open up any type of insurance book, and there they go, right? And they're very good. Don't get me wrong; they're very good in what they're doing, but they're limited to conventional care. If you want to know anything beyond that, you've got to look beyond the box and identify those providers who have additional training, right, to guide you in that endeavor.
Right, and that would be. I see from this wall. There's a lot of osteopath and longevity. There's caring for the whole person, not for the symptom.
Well, I started as an osteopathic physician because back then I was going to be a naturopath. But, again, I allow me to speak truthfully because naturopathic physicians still have limitation in the scope of their practice. The only thing that is close to a naturopathic physician back then, 20-something years ago, is to be osteopathic doctor. Mm-hmm. So I become a DO back then. I went to DO school, which, and which is more holistic.
Where do I find someone like you?
Okay. That is a good question because most of my patients are referred. So, like I said earlier, start with a professional organization like the American Holistic Medical Association. There are different professional organizations out there, like American Academy of Anti-Aging Medicine. I will name a few, right? Functional medicine. Right. So if you Google those professional organizations, it's a good start to identify those.
I'll put a bunch of links down below in the description so you can
I can send you those, and it's a good start, right? But I think that's a good start. But ultimately, I mean, doctors are just like anyone else. You have to find the one that not just with their clinical skills, right? Also the personality, right? Not every patient like me. Right, even though I have the skill, perhaps, and the credentials, right, but that doesn't mean I'll be right for that particular doctor. So ultimately, like I said, to start out, yes, go through the list provided by professional organizations, but it's more important to talk to people in your area, right, and say, hey, do who do you go to that practice beyond the box medicine, that focus on wellness, not just diseases, and look for referrals because most of us are word of mouth, right? We can do internet marketing, we can do everything that we do nowadays, but I still think the word of mouth is key when it comes to this type of healthcare. Right?
So as you can see, Dr. Chan is quite an animated physician. And that's because he cares so much about helping people stay out of the healthcare system. If you'd like to connect, if you'd like to learn more, ask him some questions, visit him at healthdestinymanagement.com, or you can connect with him at 360min.net. And I really encourage you to subscribe below to our YouTube channel and meet a bunch more interesting men.